I actually have been involved with wound care first in my career as a active duty Navy plastic surgeon. When I retired, I was in private practice for 12 years and worked in a relatively rural community where we saw a lot of wound problems. And so I immediately became interested in wound care and used hyperbarics and other reconstructive methods, and actually ran a wound care center at a small clinic in Suffolk, Virginia. When I retired from that practice, I was asked to become a medical director where we do hyperbaric oxygens, and we see multiple wound care problems on a daily basis and have people in the hyperbaric chambers for the more complex problems. Good evidence is probably based on clinical trials, preferably randomized clinical trials, and preferably prospective randomized clinical trials and double blind. So, they would be the best. Now, very hard to do that in a lot of wound care settings. How do you do prospective randomized trials in complex, very different wound care situations? So, doing it with live patients, that presents a lot of complicated situations. I guess, you'd have to look at some of the animal studies to find out how things are done in vitro and in vivo, and using journal articles or studies, particularly from university centers or people that have had a lot of experience with those trials. Yeah, I think outcome evidence is going to be more and more important. It's as the government is getting and putting more mandates on physicians and hospitals and systems to come up with good outcomes, I think this is going to carry over into the private sector. So we're going to have good outcomes in order to get insurance reimbursement for different products.